All right, welcome back. I hope you're having an amazing time so far. Our next speaker is Raymond Moe. He's the co-founder and CEO at BioMind. Please join me in welcoming him to the virtual stage.
Hi, good day. Distinguished leaders, ladies and gentlemen, my name is Raymond. I'm the co-founder and CEO of BioMind. Now, BioMind is a deep learning company, and we specialize in creating predictive applications for healthcare. In particular, we use AI technologies to help doctors diagnose and treat medical conditions. And our mission is to empower doctors with machine intelligence so patients around the world can benefit from fast, accurate, and consistent diagnosis and treatment. We are an ISO certified medical device company, and we have a global headcount of over 300 staff. And we have had developed as well as deployed our solutions in more than 150 hospitals globally, mainly in the use of in the clinical space, as well as to promote teaching and scientific research. Now, if I were to summarize the challenges or the pain points that we are trying to tackle, I'll use these three buckets to summarize. Now, first of all, is the fact that many patients, they have to wait for a long period of time to take a scan in public hospitals. And this inefficiencies is mainly due to the fact that data takes time to be processed and be analyzed by doctors. And it is also a highly disconcerting trend to see that the misdiagnosis volume or misdiagnosis rate has gone up quite a lot in the past few years. Now, if you look at some of these big countries, we are seeing like the order of magnitude of millions of cases of misdiagnosis in a year alone. And if we are able to correct just 1%, we are talking about saving hundreds and thousands of lives in a year. And to make matters worse, there is a mismatch between the supply of doctors as well as the demand for their services. And in this case, I'm referring to imaging specialists or radiologists, because in terms of big data allocation, the weightage of data, most of it comes from medical imaging. Medical imaging takes up more than 90% of all the data combined together. And recently, some reports have also, they have sounded the alarm saying that there will be a crisis after the crisis, because during the pandemic, there's an accumulation and a backlog of imaging exams that have been pushed back or postponed because of the reutilization and reallocation of resources to manage COVID-19 patients. And all this results in a wide variety of repercussions, which comes from, say, due to the lack of patient care, wrong treatment, or even death. So here we are. We have developed an AI application that uses deep learning to analyze medical images such as CT and MRI scans. So for example, whenever the medical image is fed into the system, the machine is able to automatically detect the presence of abnormalities. It will segment the lesions, it will localize it, and then recommend a diagnosis before generating a report to document the quantitative information about these abnormalities. One example is in the area of brain tumor disease type. This is a very complicated disease because there's a wide variety of brain tumors and there's a lot of brain mimics. So this makes accurate diagnosis difficult. This often affects treatment approaches. So what we have done is to train the machine using ground truth, and that is using biopsy results that maps the corresponding imaging features of specific brain tumor types. And this allows differential diagnosis of brain tumors to be performed in an accurate manner. And by doing so, it helps to facilitate decision-making of clinicians in determining the type of brain tumor. Another case in point is the use of deep learning to detect and to differentiate the CSVD conditions. These are small vessel disease that affects aging conditions like Parkinson's disease, dementia, and the use of deep learning in this case, it really helps to detect even the very small lesions, which are often too small for the naked eye to be picked up. So by using machine learning, it helps to reduce the blind spots of the physicians. In the area of stroke, we are able to not only detect stroke, but also recognize the subtypes of the stroke itself. For example, in the case of ischemic stroke, we are also able to do one layer deeper by comparing against the various modalities. It is very often that stroke patients have to take multiple scans, such as not only CT scans, but also CTA and MRI scans, so that they are able to see whether there's any blockage of the arteries or the narrowing of the blood vessels. So this is when machine learning is important, because it is able to enhance the visualization of the blood vessels. Over here, in this case, we see that deep learning can help to perform a 3D visualization of the blood vessels, pick up the affected blood vessels, straighten it, and zoom in into the part whereby the blockage occur, and to measure the quantitative information related to the severity of the narrowing of the blood vessel in this case, and generate into a report automatically. So this helps to enable a huge time savings for the clinicians, in particular neurologists, who usually have to spend a longer period of time manually analyzing the images. And to take one step further for AI, we have trained the machines to be able to predict the prognosis progress of stroke patients. So take this example. This is a case of intracerebral hemorrhagic stroke, which is one of the most disabling and a deadly form of stroke. And that often results in the wrong treatment. But the problem about this kind of stroke is that it is very time critical. So every second counts. And in this case, the machine can complement the doctors by being able to predict how the stroke bleeding can continue to occur over the next 24 hours. Now, given the baseline condition of within the first few hours, the machine can make judgment whether the bleeding of the hematoma will continue to worsen or otherwise. And this can help the clinicians to make effective decisions by ensuring that the right treatment approach has been administered at the right time. And to put this into test, this is one of the biggest public evaluations that has been conducted on any AI machine. Over here, we see that the world's some of the world's best neuroradiologists, as well as neurologists, came to challenge the machine in two separate contests. One to diagnose brain tumors or MRI scans, and the other is to predict the ICH hematoma expansion on CT scans. We see that in both cases, the machine is on average 20% more accurate than the human clinicians. Since then, we have obtained quite a number of medical device certifications, which are necessary for us to integrate our solution into the clinical space in order to help the clinicians to perform their work better. Now, at the end of 2019, this is when the outbreak of COVID-19 was first discovered. And since then, many lives have been lost. 1 month ago, the number of COVID-19 deaths have passed the 4 million mark. And during this entire journey, we see that especially during the early outbreak of the disease, there are many pain points that hospitals are experiencing. For example, the lack of PCR tests, the lack of the PCR reagents, and a high number of false negative results using PCR solutions. And this is when many hospitals, they have to rely on their existing medical equipment to do fast screening and hence a fast intervention. So for example, the use of CT scanners. Many countries like, for example, China, India, they have resorted to the use of CT scanners or even X-rays to do this quick detection. And this is when we come in, right? We develop a COVID-19 application that made use of the techniques that we developed for our brain diagnostic solution. In this case, we train on big data using ground truth, and the ground truth has been determined by the PCR confirmed cases and map it to the corresponding CT images of patients. And this is really important because during the early outbreak of the disease, the knowledge related to this new viral pneumonia was very limited. So the ability to differentiate COVID-19 pneumonia from other viral pneumonia, it is very complex. And therefore, our machine in this case can help to enable the clinicians to make a better and a more accurate decision. And this is one of the articles we have published on Nature. In this case, it demonstrates how we scale diagnosis automatically and how we are able to complement other resources to combat the pandemic. And there are some insights that we have also shared. And in this case, our system has been deployed in 6 hospitals in China. And in this article, you can also see how the solution can be scaled to complement other existing resources in the hospitals. Since then, we have deployed our solution in more than 150 COVID-19 designated hospitals worldwide. And we have also received CE mark, Singapore HSA, to name a few, so that we can use our solutions to help hospitals to manage the COVID-19 pandemic. Our company has won numerous awards internationally, and we have also been featured in many media. But there's one common denominator that we learned is the combined efforts of the clinicians as well as the machine can enable a better healthcare outcome. Because both the machine and the clinicians, they have their own blind spots. And therefore, if we were to combine the strength of both the machine and the clinician, it can result in a more synergistic outcome. And with that, I would like to thank you for your time, and I hope that I've given you a good flavor of how AI can enable a better health care outcome. Thank you. I look forward to any questions from the audience.
Wow, thank you, Raymond. That was awesome. And I know this audience is giving you a huge virtual round of applause. Thank you so much for sharing with us today. For the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our amazing exhibits. Thanks so much, and I'll see you around.